This meeting is being recorded.
Welcome to Innovation Dialogue. I'm Diana Ding, and today together with me is Jian Zhang and Dennis Wu. March is Women's History Month. We celebrate countless women who have fought tirelessly for the equality, justice, and opportunities in our nation. Today, we have the great woman leader that I respect and love, Jian Zhang. And why she's so special, I'm going to invite my friend and another well-respected community leader from San Francisco course, Dennis Wu, to give us a brief introduction about Jian. Dennis, thank you.
Thank you, Diana. Less than a week ago was the third anniversary of the lockdown in the city of San Francisco. Our mayor, London Breed, was very courageous in initiating that days before the state of California did it and before it was done in the country. I expected the very worst in Chinatown. The week before, I was actually in Chinatown, was at a restaurant, was practically empty. I had a guest and I took her back to the hotel. We drove through Chinatown. Chinatown was totally deserted. I asked myself, what could happen to our Chinatown? Hundreds of thousands of our fellow Americans had already died from COVID-19. A year later, we had a summit on conquering viruses together. COVID-19, inequity, hate, and racism. And it featured many prominent San Francisco and state of California public officials and community leaders, including Attorney General Rob Bonta, Mayor Breed, City Assessor Joaquin Torres, JCRC CEO Ty Gregory. And that was the first time that I actually met Jian Zhang, the CEO of Chinese Hospital. And so what did happen? Why didn't we have the pandemic, the crisis in Chinatown with the crowded SROs, and all the things that I had thought would happen in Chinatown? It didn't happen because Chinese Hospital, under the CEO Zhang's leadership, had 2 months earlier gone through Chinatown and told the people that they needed to do something, that they need to lock down early. And that's what happened. And so she had a chance to tell her story that day in a summit. She was actually our first speaker. And I think it was so very appropriate that our Assemblyman Matt Haney honored her as the Woman of the Year for his district last week. So it's my pleasure to introduce to you Jian Zhang.
Thank you. Thank you so much, Dennis. Jian, congratulations again. Women of the Year is not only your honor, it's the honor for our whole Chinese community. And today we have Joe Wang, our chief editor, and also community leader to do the interview. So Joe, I'm going to hand over the microphone to you. Thank you, Joe.
Yang, congratulations, well done. I presume that you did not came to this country all prepared to be the CEO of the Chinese hospital and battle the pandemic in Chinatown. Tell us a little bit about your journey as an immigrant and how do you become a community leader?
Thank you, Joe. Thank you, Diana. And thank you, Dennis, for the kind words. Really, Joe, you're right. I definitely didn't anticipate any of this. So I came from China originally in the early 1900s to study at UCSF. So when I was a student at UCSF, one day I was told by my professor, my advisor, to go to Chinese hospital to do my clinical rotation. I was shocked at that time and say, really, there's a Chinese hospital here in United States, right? So that's how I started at Chinese hospital. It was a heartbreaking to see, at that time when I went to Chinese hospital, it was a very, very different than now. And so the first thing I noticed was that there were so many new immigrant women at that time didn't have insurance, worked 3 to 4 jobs to make the ends meet. And of course, mom, right? You take care of your children, you take care of your family, never themselves, right? So they could not even afford to have a mammogram. 1 in 8 women, Chinese women suffers of breast cancer, but they knew, right? But they couldn't afford to have that mammogram. So I started writing grants to get money to cover, the mammogram for those women. And one thing lead to the other, and later on that I brought in every woman counts to the Chinese community. So every woman could get a mammogram or a pap smear to early detect breast cancer or cervical cancer. So that's kind of how I started at Chinese hospital. And this is my 30th year working for Chinese hospital. And didn't seem that long. So I kind of like a little highlight of my career at Chinese hospital is that I started at as a student, and then I work in many different departments, including med surg, emergency room, education department, case management. And later on that I started all the clinics. I spent 20 years building all the outpatient center and the outpatient clinics to expand Chinese hospital outpatient services to outskirts San Francisco and San Mateo County, because Chinese or new immigrants are coming in, they don't necessarily stay in Chinatown anymore, right? So they move other parts of the county and other counties. So that's kind of, and then later on 2015, I went back to the hospital itself to become the COO, and 2017, I became the CEO. And yeah, it's a long journey, and but it's very challenging but really rewarding.
Long story short, you came to this country and you as a student, and you joined the Chinese hospital, and basically you work your way from bottom to top. So congratulations, well done. Tell us a little bit about the role the Chinese hospital played during the pandemic. Everybody thought Chinatown is so close together. People live so close together. It's basically a miracle that the pandemic did not hit, it very hard at all, if anything. So tell us a little bit about the role the Chinese hospital played during the pandemic.
Will do. Thank you. That's the question I got asked a lot, right? From media, from, kind of like a lot of people. So Chinatown, that's the reason why people ask that question, because San Francisco Chinatown is the second most densely populated area in the nation. And so the first one is Manhattan in New York. And so at the beginning of COVID-19 back in January 2020. And so I had this tour with Supervisor Paskin kind of to visit Chinatown, the SROs, and shocked me so much. I'm like, oh my God, because you're seeing a family of 4, living in a room, basically, right? And then about probably 20 square meters, and that's very small. And then they share a bathroom, share a kitchen, share a shower room. And there's no way to social distance these people. And so that's kind of like, I look at him and he looked at me, and I've said, Supervisor Peskin, if we have an outbreak in San Francisco Chinatown, it's going to be a nightmare of yours and mine. And so we need to do something about this. So kind of we started very early. At that time also, you probably remember, it's a January 25th, it's a Chinese New Year. And the day before, which was the Chinese New Year Eve, I got a call from a Deputy Consul General asking me to order some N95. So I placed an order. I asked my purchasing department to place an order. And guess what? This is January 24th, right? Before we had any case. And that was back ordered. Meaning we couldn't even get any N95, but in January 24th, before we had any case. So that scared me the most, because then we were thinking like, oh my God, if we can't protect our providers, how can you provide care to the community? So that was the biggest challenge. And we'll talk about that when we have time. That's like a full long story, talk about how we secure a pathway to get PPE to protect our provider and staff. And so that was the one thing. The other thing too, because it's a Chinese New Year, a lot of people, our residents went back to China for Chinese New Year, or people coming back from China, right? So after the Chinese New Year. So that's kind of like, really, you're talking about when Wuhan had that outbreak, this is 12 hours away, right? So, because we have direct flights. And so a lot of the reason, and also too in San Francisco, Chinatown, we have so many single room occupancy hotels or housing, like a lot of seniors live in there too. So the seniors, they have underlying medical conditions, they're at a lot higher risk, right, for COVID-19. So given all those risks, that we make the decision that we have to plan earlier. And a lot of the things that we did, we created bilingual educational materials. The hardest thing wasn't the work, hardest at that time, because we didn't know much about COVID-19. And so that's what we learned. I have colleagues in China, then we talk, right? So my classmate was deployed to Wuhan and to help out. And she was leading a 52-unit ICU there to help Wuhan. And so I learned a lot of information from different colleagues there helping out in Wuhan. And I also communicated with the president of hospitals there, that they deploy entire team there to monitor a county. And so they have this model kind of similar to our situation in a way. So what they did is that they built this system that very including testing, contact tracing, quarantine, linkage of care, and education, and really a lot of outreach to monitor the residents so they can report any symptoms and early to them, and they could deploy fast. That was a kind of similar model we used for San Francisco Chinatown. And so we started that bilingual hotlines. So many people, you probably remember at that time, CVS, Walgreens, all the stores, everything, the shelves were empty, right? No mask, no hand sanitizer, nothing left. Everybody were in this panic reaction. So they were doing a lot of things that not helping. So our focus at that time, the community outreach, was to educate the community, not to state like this in this pandemic reaction. We encourage them to help out each other, share resources, not to take everything, grab everything, and others don't have any. And the other thing is that to really wash their hands. At that time, you probably remember early on that it wasn't airborne. It was a droplet, remember? So that's why we were helping people that to clean their hands, don't touch their face. At that time, there was absolutely no mask. So we didn't, and it wasn't airborne either. So we didn't promote wearing mask at the very beginning because there was no mask. Our providers didn't even have mask. At the very first community press conference on February 1st, that we did it with the community leaders at CCBA, I actually demonstrated to people how to wash their hands, how to keep their hands from their face, and I actually advised them not to empty all the mask, save them for providers so they can save lives, because we didn't have any, right? And so a lot of the actions that we took at that time was very different than nowadays. Now we know everything about COVID-19, right? And so we also taught the communities and the SRO managers, workers, and to kind of how to clean their doorknobs, like kitchen surface and like the handle of the bathroom, because everybody touched that, right? And then so that kind of thing, how to clean the environment and how to alternate the time when they use the kitchen, or so they can kind of somehow keep the social distance, right? So a lot of this education was done very early on, and inside Chinese hospital, we were doing a lot of the preparation, converted our clinics into COVID clinic, and then also to really create this a mobile clinic, and so to go to the community, so we could provide testing or education, or later on for vaccination, that the mobile clinic. And so, and now don't forget that no money, no mission. We couldn't do anything because if we don't have money. So at that time, we have to write grants actually to cover all the costs. And so I've been writing grants for over 25 years. Actually, very first time I got a grant from Stupsky Foundation. Really appreciate that, like the visionary leadership of and the vision and from Stupsky Foundation. They gave me the $250,000 in 3 business days. Like, so we could set up that mobile clinic to go to the community to provide the services. And later on, we got other money coming in to continue the effort for 3 years. Actually, the COVID team was out there doing everything for a long time. Now, after the lockdown, after the shelter-in-place order was implemented, and it was harder for hospitals because we had to cancel all the elective procedures. So meaning no elective procedures and no money, right? But we have to do more for the community without income. So a financial challenge was huge. To me, probably that's what kept me up at night more so. And in addition to looking for the PPE. And so we have a lot of help, actually, a lot of people helping us. So even some, Wilson Chen, who is a long-term supporter to Chinese hospital, helped me find the manufacturer in China who could give us the PPE. And then we have to, don't forget that our president stopped the flights. So like getting those PPE from China to here was another challenge, right? So then there's a FlexPod and other, companies help us get the PPE here, and also then help us get the PPE out of the custom too. Remember that at that time how difficult it was to work with the custom to get that. So able to build that that pathway to bring PPEs really give us a lot more confidence. We were told by hospital association that all the CEOs at that time in San Francisco, like all the CEOs, hospital CEOs met every week. We talk about like how we could in a way work together to balance the resources and things like that to work together. We were told at one meeting that be prepared for the worst. You will not have any help. You're on your own. And so it could get really bad, like New York, right? Remember how bad New York was? And so just be prepared that you have to deal with this on your own. So after that meeting, I told the team, I ordered a raincoat for myself. Raincoats are better than garbage bag, right? And then so we ordered another 500 raincoats for, just in case, like when we run out of PPE, then our providers can wear the raincoat. The better than put a garbage bag on, right? So really now I can smile and talk about this, but it wasn't like this back then, right? So even a lot of our providers actually put a tent up in their garage, or they stay in a hotel because they have parents who are really sick at home, right? They don't want to bring the virus home to their family. And so that kind of thing. So a lot of the things happening at that time, now when we think about it, it's like, thank God that we didn't have that outbreak in Chinatown. So like Dennis say, I don't think it's by luck, right? There are people were saying, oh, Chinatown by luck didn't have an outbreak. And my team together with DPH and community leaders and the media. I really, really appreciate the media, the reporters. The reporters was at Chinese hospital all the time, like sometimes every day at the beginning, because you can't find information from official sites, right? Because we didn't know much, then we need to find out about the information and then put it in Chinese, like so the media could take it to the community. They play a key role. I think our media play a key role in disseminating the information to the community. And our bilingual hotline, at the beginning, we have 2 staff. But at the peak, we increased to 6. Still not enough. We couldn't answer all the calls. It was like the panic reaction from the public was tremendous. It's just like really, everybody was so worried, so they were calling. So that's why there are a lot of things that happening at that time that we learn, and then we learn, and then we talk to the media, and then we work with the community leaders and kind of like really get the community prepared for that. When the pandemic, when the actual positive cases hit, I feel like Chinese hospital was more ready because we prepare early. So that's why we're very proud that actually San Francisco Chinatown remained one of the areas with the lowest infection rate for a long time, right? And so kind of like, and then also too, Chinese hospital providers and staff, we're the only hospital that our providers did not have to reuse of the N95. That because we prepare early too, I think that's kind of something that we're very proud. And then we did not have hospital acquired infection. So that's because of all those preparation. And I think that's very, I mean, we're very thankful for all the support too, right? From the community and from other partners too. And so that's kind of, I'm really grateful to my team, even though it was so difficult. We all was scared too. I'm sure they were scared too, but they show up to work, right? Did not take off or anything. So I really greatly appreciate that. And board members, they actually came in. I'm like, no, stay home, don't come in. But they come in, and they even started fundraising events, like, Sintao radio, Chinese radio actually held a fundraising event during the pandemic with our board members, like to raise funding to support, and our donors really supported too. And we did not just fight against COVID. We, for Chinatown, we actually quickly opened our second floor to take patients from San Francisco General Hospital, so they could have more beds to take care of COVID patients too. And we elevated our ED during the pandemic to take sicker patients. And then we opened a cancer center so our cancer patients could continue to get their infusion, like their chemotherapy and all those, without going through the hospital. So there are a lot of things that we actually created during the pandemic to keep our patients safe and to continue providing care and created new services too.
Sure.
So yeah, it's a lot of things. It seems like so long ago. Yeah.
Yeah. You plan well, you mobilize your team and you mobilize the community, and you were able to convey the message well to the public. And those are the things. Let me ask, the time is running short because we only have 25 minutes on the program. Let me ask you 3 quick questions. One is, how do you raise money for the Chinese hospital? And 2, what are your biggest challenges at Chinese hospital? And also, what are your future plans for the hospital?
Great question. So Chinese hospital was established back in 1899 when overseas Chinese came to United States to build the railroads. Sadly, when they were sick, they were not allowed to go to the mainstream hospitals. So that's how Chinese hospital was established. And so it's very much part of our history, right? And so I think that Chinese hospital mainly served the low-income immigrant community. And so that's why this number probably a lot of people don't know. Every dollar we spend taking care of this low-income people like Medicare and Medi-Cal, the reimbursement we got back is about 74 to 75 cents. Meaning every dollar we spend, we have to lose 25 cents. So fundraising is very important, but subsidies is very important for the sustainability of Chinese hospital. And it's very important. I mean, COVID is over, but I didn't talk about the bubonic plague actually. Right after Chinese hospital was open in the early 1900s, and bubonic plague hit San Francisco. And so at that time, walls was built around Chinatown. Then meaning you deal with it, you deal with it yourself, right? Like the only place that people could go to was Chinese hospital. So already 2 public health crises in the past 124 years. And we know there more will come, right? It could be earthquake, it could be another virus, could be another disease. So Chinese hospital is very, very important for the community. And I think very important for us to support. Now, I myself spent 30 years, more than half of my life, advocating for Chinese hospital and Chinese community. I really hope the community will stand up and support Chinese hospital. And because we don't get funding from the government. The very first time we get the $5 million from the state last year, and thanks to Assemblyman 15 to support, right? And so we need more of that government support. We also need our communities to support too for that. The biggest challenge, and really, it's the financial challenge, right? Because we are serving the low-income people, and the reimbursement is so low. And so in the future, I think it's very important for all of us to stand up and speak up for Chinese hospital. So I have been working with all level of governments to try to get support and really advocating Chinese hospital in the community to raise funding to sustain Chinese hospital. And I think that it's very, very important for Chinese hospital to stay in the community and continue to serve the community. And another thing I think real quick to address is that we didn't just fight for COVID and the COVID-related anti-Asian hate crimes. And our patients got attacked, our employees got attacked during pandemic. They got yelled at, really get out of here, go back to China. And these employees were not even from China. It's ridiculous that hate, right? So that's something I think as a community, we need to stand together. And so our voice is stronger and we can fight against that.
Jian, this is Dennis. You need to tell them about your 124th in celebration coming up, because that's a fundraiser.
That's right. So this April 18 will be our 124 years of anniversary celebration, and we're going to have a fundraiser. It's a dinner program at the HL in South San Francisco, and so we welcome the community to join us and celebrate our 124 years of high quality of care to the community. Another point, Chinese hospital is one of the only 2 4-star hospitals in San Francisco. The other one is our partner UCSF. So we are small, but we're really providing the very high quality care to the community, not just during the pandemic, right?
Owned by the community. Chinese hospital is owned by the community.
Right.
That's right. So Chinese hospital is a non-profit hospital. It's created by the community. It's here to serve the community. So it belongs to the community. I think to me, it's not just a hospital. It's a really very much part of our history. And also too, think about it, in San Francisco, Chinese hospital, I think because of Chinese hospital, we have over 500 employees there, right? So we actually make San Francisco Chinatown more viable too. Think about it. So then, we bring in the patients to San Francisco Chinatown, and our employees shop in San Francisco Chinatown, right? So it's a lot of, that's why I think San Francisco Chinatown is the most, really viable Chinatown, I think. You go elsewhere. A lot of people ask me, a group of people from Canada, and ask, how do you maintain your Chinatown being so viable? And so their Chinatown is like, a lot of Chinatowns are dying, and not just in the United States, elsewhere too. So I think that's something that we need to think about. And also too, though, a lot of people were born at Chinese hospital. You know why? Because in the past, Chinese hospital was the only hospital Chinese could go to, because then, they're not allowed to go to elsewhere. So we have so many elected officials, so many outstanding Chinese in different fields who were born at Chinese hospital. And in San Francisco, a lot of people probably don't know that there's 37% Asian, 23% Chinese. So it's very, very significant, right? If we stay together, I think we can have a lot stronger voice.
This is great. I think, thank you for, serving the community. Thank you for explaining the Chinese hospital and its significance to the community, to us. Unfortunately, we run out of time. Diana, do you have any last word to say?
Oh, thank you. Thank you, Joe. First of all, I want to thanks to Jian, thanks to Dennis, and thanks to Joe. Like Jian just mentioned, our community stand together. This is why we're all here, and we are the community. We stand together and support each other. And Jian, actually, I know you for over 15 or 16 years. When I was in the media, in the TV station, I interviewed you, I think about 16 years ago. You never changed, always full of passion, because the first time I saw you, I can feel the strong passion and love for what you are doing. And it's truly a miracle that Chinese hospital belongs to the community and can survive for so many years, and have helped so many families, and so many people were born in this hospital. It's truly, truly amazing. And when you were talking, I heard that you mentioned that sometimes, especially in a critical moment, people told you that you are on your own. You have to deal this all by yourself. That's a moment, especially as a woman leader, as a women entrepreneur, you and me, we experienced that moment. So where did you find your strengths as a woman in the industry, in your career? What is the most enjoyable moment of your life? And where do you find the strengths at that moment?
Thank you, Diana. I think that we share that passion. Being an Asian woman, we have to face double glass ceilings, right? And moving up to this career ladder wasn't easy. And when we have time, we'll talk about that. And I think it's very important that for Asian women to hear about our story, and so they can really move up, really take the leadership positions, tend to advance women's influence in all fields. I think it's very important. As we celebrate this like a Woman History Month. And I also think when I received the award, I feel like that award validates that Asian women can be outstanding leaders, right, too. And I think that's very significant. And then the other thing that where do I get my strength? I think I know Diana knows this, that really that how do we improve the status of Asian Americans, and then or especially Asian American women. And I think that's kind of what during the pandemic, especially at the very beginning, and one voice I kept telling, kind of like could be that it's just myself like thinking that we cannot have the outbreak. Otherwise, the people is gonna say, see, it is Chinese virus, right? And then a lot of times that just about that, we have to prove them wrong. The virus can infect anybody, regardless of their color, right? It's not a Chinese virus. We had to fight that. So that was kind of something that to keep me and I keep telling my team, we cannot let a huge outbreak happen in San Francisco, Chinatown. So that was kind of the voice. I mean, for my 30 years in serving the low-income Chinese community, and I think a lot of it is that we have to fight for those people who cannot fight for themselves, right? Like a lot of women, then they don't even speak English, and then they don't have the capacity or to fight for themselves, then we have to fight for them. So that's kind of something like I work for so many years that we were working on so many different grants to bring fundings to support women so they can access the healthcare. And that's kind of really I guess give me strength, give me a purpose to fight for them. And I think it's something, I know you're not, and I know you know that you're fighting for them too. We all, I think, on different positions that we're fighting for our community. So that's why that I really strongly advocate for all of us to work together so we can have a stronger voice, so we can bring in more resources to our community so our community can have better access to health, like the health equity, and also access and social justice and all those things that we're fighting for, right?
Thank you so much. We're fighting for the people who cannot fight for themselves. It's not Chinese virus. It's Chinese community fighting the virus.
That's right.
Yes, it's so inspiring. Thank you so much, Jian. And thank you again, Joe and Dennis. And it's coming to the end of our show. So Jian, I hope that you will come back and we're going to continue the story and share with our community. Thank you all and see you next time.
Thank you.
Thank you.
Thank you.
Thank you. Bye.
Bye-bye.